All right. So good afternoon, everyone. Welcome to our next Explore MedTech seminar for the MedTech Talent Accelerator. This is kind of a double header. So we're doing this Explore MedTech session from 12 to 1 p.m. And then following this from 1 to 2 p.m., we will have an experienced MedTech program information session. So that'll start at 1 p.m. So today we have Courtney Cole, CEO of ForaHealthyMe, and he will be talking to us about addressing systemic gaps in community health with digital technology solutions. But before we get into that, I will start with a land acknowledgement. So Toronto is in the dish with one spoon territory. The dish with one spoon is a treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the treaty and protect the land. Subsequent indigenous nations and peoples, Europeans and all newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. We hope to honor that. So with the agenda, so in terms of the agenda, again, as I go through the agenda, if you could please in the chat function, if you're a student, if you could put down your program and what year you're in your degree program, master's or PhD, please indicate that. And then if you're not a student, if you're faculty, or if you're from the community, please feel free to just identify your role and title, so we know who's here with us today, and that helps our speaker also cater our conversation to the audience. So if you can do that. So in terms of an agenda, so I will give a brief overview of the MedTech Talent Accelerator, and then we'll get into the seminar. And then at the end, we'll have a Q&A with Courtney. And then once after the Explore MedTech seminar, we'll get into the Experience MedTech info session, which will last from 1 to 2 p.m. So just to kind of give you an overview of what the MedTech Talent Accelerator is. So we are a training program focused on a training and transitioning program focused on the medical technology industry, where our focus is on transitioning new talent, specifically graduate students from Ryerson and McGill to the medical technology industry. The way we're doing this is through these two bubbles. So one is called Explore MedTech. So here, the goal here, and our seminar today is a part of it, is where we bring leaders from the industry to talk about, what is current, what are the innovations that are taking place, and what is exciting that's happening in the industry, so that our students can become more aware of what the medical technology industry is all about. So we host these seminars at least once a month. And anybody at Ryerson or McGill, or even in the community, is welcome to attend. We also host a hackathon a year for the same purpose of just giving exposure to the industry for students. Our last one was in October, and the next one we're looking at is probably this summer. The second bubble that we support, and again, the info session is from 1 onwards, so I won't go into too much details here. But in the Experience MedTech, this is for final year students in their graduate programs. We have you apply to us to identify that you're interested in working in the medtech industry, and then we work with our partners to find you an internship. And then before you go off on the internship, we give you some significant training about the industry. So this is around the business side and R&D side of the medical technology industry. Again, as a kind of summative statement, I'd say, you as students are studying in disciplines. It could be biology, physics, engineering. Again, you're becoming subject matter experts in those disciplines. The goal of this program is to then use that and transition you into thinking about industries, and medical technology being one that your skill set would be valuable for. So with that, so that's the program. Again, if you have any questions about the program, we are doing an info session right after this, so you can address that to me then. Without further ado, I'd like to introduce Courtney to the participants here. So Courtney is the founder and CEO of ForaHealthyMe, based in Markham, Ontario. ForaHealthyMe utilizes AI, computer vision, and gaming technology to equip health providers with tools including telehealth and telerehab technology to address musculoskeletal, cardiac, neurological, and cognitive healthcare issues. With operations and partners in Canada, US, Asia, and Europe, the company develops and licenses its suites of virtual care technology solutions to health institutions. So without further ado, Courtney, please take over from here. I'll stop sharing my screen and I'll request you to share yours to begin the seminar.
Thank you, Adnan. Screen sharing. Can everyone see my screen?
Yes.
Yeah, you can? Okay, awesome. Thanks again, Adnan, and thanks for having me. We've been in discussions and conversations for quite some time. In fact, this presentation was to take place last April, but since then I've had to revise and revamp the entire format because the world has changed and our business has changed so much. Thanks everyone for taking time from your schedules to join us today. I'm hoping to impart a bit of knowledge, some insights, some information based on our own research, some work that we've done, experiences, conversations from multiple stakeholders, both here and overseas. But I'll also try to give you a very broad perspective on community health, the industry, where technology is going, what some of the trends are, and what I'd love for you to take away from this, and I look forward to your questions, is your own ideas, your own interpretations, you're forming your own opinions around the information I present. I think we're in a state of flux right now, and there are a lot of unknowns. And I think going forward, we're going to be charting certain new courses. So I'll be talking to you about some of the work that we do. I'll present a use case, some more work with spinal cord injury patients, and I'll touch on virtual care. And virtual care is going to be used very broadly because it means a lot of things to a lot of different people. It could mean a phone call, it could mean sending a text message to your physician, or it could mean a video call, or it could mean remote patient care monitoring for BP, heart rate, or in our case, remote rehab. I look at some of the gaps that this is pre-COVID, and I specifically want to focus on sort of the pre-COVID environment because it will help to set things up for where we go from here, what are some of the opportunities and some of the areas that you should potentially be considering as we go forward. And then I'd be happy to take your questions. So I'll start with a quote, and it says, each generation imagines that we're all going to hell. And if you don't believe in hell, well, think of it as a symbolic representation of a place that no one wants to go to. Nobody wants to spend any time there. But whilst we may not necessarily transition to that place, the saying from Paul Harvey, who was a US radio broadcaster working for ABC, is each generation goes through a little hell and comes out heat-tempered and better than before. And I think that's kind of what we're going through right now. It seems extraordinarily difficult. 11 months ago, no one would have imagined that we would have still been confined to home. I mean, my team, we thought things were going to be, but back by July, we would have been back in office. That hasn't happened. And so what we've had to do is to really look at how we work, what we work. I never imagined that for us, because we work in a very collaborative environment where we're developing applications, we're developing code, we're working in the lab, we're testing things, we're looking over each other's shoulders and just learning as we go along. I didn't think that we could survive in a work from home environment. But now we have, and we've actually thrived. What we do in a very broad context, and I'll get into some specifics, is we started some years ago, we started to look at how could we use technology in more innovative ways to address some of the significant gaps in care for patients with musculoskeletal, neurocardiology, and cognitive impairment issues. So we're looking at really complex chronic health issues that require sometimes acute care, but certainly ongoing monitoring, rehab protocols, which can be very, very complex, but also very expensive. Another layer of work that we look at, and we seek to address effectively the disconnect between the physical and mental health. Our view has always been that for any care organization, and we're starting to see more and more of that right now, is both mental and physical health go hand in hand. The two are bidirectional. And so a chronic illness will impact the patient's mental health. The patient's mental health will impact their chronic illness. As we sort of go forward, what we've done is to look at how could we use innovative models, how could we use technology to address some of those gaps, looking at, as I talked about, physical and mental health. How do we use AI? How do we use computer vision technology? How do we use gaming technology to bridge the divide between the patient and the healthcare provider or the healthcare institution? And we've done quite a significant amount of work in that area. We've done a lot of validation. So on a macro level, it's around healthcare delivery and care coordination, okay? Using MedTech innovations to bridge some of those gaps, right? Driving connected care, reducing the need for inpatient care. Until last March of last year, when in specific reference to Ontario, there was a single provider of virtual care services, which was the Ontario Telemedicine Network. And then suddenly it just wasn't enough. Okay, systems were overrun, hospitals were crowded, people needed help, and the infrastructure just wasn't there to support them. Well, I think what we've been trying to do is to look at today's problems, and we're trying to build solutions for tomorrow. We have a great sense of what some of those problems will be post-COVID, whether they're individuals who recovered from COVID and as a result have had ongoing chronic illnesses, or just the factors related to mental health going forward. And we worked within the environment to sort of collaborate with different partners from a system integration perspective. So we work with a partner like Point Click Care. They are the largest electronic health record services provider in North America in the home care and long-term care space. So with integration, we can share data, our systems can share data back and forth. So a customer who's using a Point Click Care application or using our application doesn't necessarily have to worry about interoperability around these complex health illnesses. We worked with Microsoft as a partner for about 5 years now, and they've been an absolutely great partner in helping us develop, design, validate, and in some cases commercialize our solutions. So we've sort of taken the approach of, when you look at comprehensive care and health, it's chronic, acute, back to chronic, ongoing disease management, and so forth. And instead of having a patient or a provider or a health system having to log on to multiple different applications to use tools and systems to get to provide the services that they want, well, we said, why don't we just integrate all of these capabilities into one single solution with some modification that would be required based on the treatment area. But you kind of get the picture. We're looking at the remote care for pre-op, so prehabilitation, prepping a patient both physically, mentally for surgery, education, coaching, getting that patient transition to surgical care. Then after they've undergone those protocols, transition into home care, discharge, effectively sort of bridging a lot of the divide and ensuring that the data, the analysis, the intelligence, all of that moves along with the patient to drive effective decision-making. So some of the partners, we've had a really long collaborative history. I was telling Jesse earlier on, working with partners from St. Mike's. These are, as you would recognize, the local Canadian partners that we worked with. We've worked with partners in Europe, in Asia, and also the US from a clinical validation perspective. So every single application that we've developed, everything that we use, have undergone clinical validation. In other words, we haven't simply built products and put them out there on the market. We've, for example, York University, we ran a 3-year randomized controlled trial in the use of mental health virtual care solutions to address youth mental health around stress, anxiety, and depression. Our work is published, presented at international conferences. Today, I'm going to take you through a quick overview of the work that we did with spinal cord injury as a use case and a quick reference point regarding how technology can be deployed effectively to address complex health issues for patients or individuals in need. So let me just go ahead. So from a publication perspective, as I mentioned, our work is, not just here in Canada, but International Society for Posture and Gait, the collaborative work we did at the Neuromechanics Lab at York University related to our virtual rehab solution was presented at the conference as a research paper. We've got 3 publications in the Journal of Medical Internet Research around youth mental health, showing reductions in stress, anxiety, and depression for undergraduate students at York. And just last summer, in September, I believe, we presented the findings from our work with McMaster University Department of Kinesiology in validating an AI-enabled range of motion solution for elderly care patients. So average age for the cohort was 78, and they were able to use the system, give us great feedback, and so those results were published at AI Health 2020, or presented rather by myself. So I'll talk to you about some examples, gaps in care, and some work that we've done and our own innovation. In 2017, we were one of a handful of organizations funded by the province of Ontario under the Health Tech Fund, the Health Technology Fund, to address complex health issues using technology. So bringing together academic, industry, and not-for-profit or a member or an organization within the healthcare system to look at persistent systemic issues related to gaps, bridging the divide between local and primary care and community settings. So we focused on patients with spinal cord injury, working with partners at Spinal Cord Injury Ontario, Toronto Rehab, University of Toronto, and the Mobility Clinic over in Kitchener. And the problem statement, as you can see, is an evaluation of a virtual care solution designed to deliver better coordinated care in local primary and community care settings for patients with SCI. So some of those challenges would be, acute care needs for patients with spinal cord injury. Then as they transition back to home care, there are gaps in terms of access to a physician in their community, especially if they live in a rural community. Travel is always an issue. And then there's a lengthy and ongoing cost of rehab, not to mention lack of access to knowledge, tools, resources, and expertise. And travel can be pretty expensive, driving to the hospital, paying for parking, etc. So we said, what if we developed a new model where instead of the patient having to find all these providers and community support workers, etc., what if we built a virtual circle of care that would have at its core all the needs of the client, all the needs of the patient, supported by technology, and then we could bring all the necessary stakeholders on board. So what that meant was looking at the capabilities with our partners from U of T and UHN around how do you improve the patient experience? How do you drive better health outcomes? How do you add value to the healthcare system? But also, how do you improve the physician experience? Okay, that meant being able to do assessments, pinpointing pain on the body, medication tracking, and a whole range of different capabilities. So this is the application, the first iteration of the application that we developed. It's an integrated, comprehensive, and cloud-based system that brought together effectively all the stakeholders I mentioned. So caregivers, the clients, the patients themselves, the physicians, community support workers, peer support within an application, a secure cloud-based solution for scheduling, coaching, messaging, medication tracking, journal tracking, health coaching, peer-to-peer management, peer-to-peer engagement. We ran the trial for 2 years here in Toronto, and this is just a snapshot of some of the results we gathered. So after 2 years, the clients, the community support workers, the providers on the system, you can see, I'll just cite this here, 76% of those clients who would have had to travel 3 hours. And keeping in mind that the province subsidizes travel for some patients across the province. So in effect, there are a lot of costs associated with commuting and traveling to see the physician, not just out of the patient's pocket, but also for the health system itself. So on average, each patient reported saving approximately $300, which for a people who are on fixed income, that's pretty significant. 250 kilometers that they didn't need to drive. Ontario is a big place where traffic gets congested. So this is pre-COVID, obviously. And sort of the community support workers needing to travel, as you know, that we get a lot of snow here. And so having necessarily to commute to remote areas can be quite costly. From the physician's perspective, for them, it was about the added value of getting a lot of data real time from the patient, but also the time saved in terms of how much time they actually spent with the patient, which meant that they could do more. So following the trial, 100% of those who were on the system reported they would continue using it. We took the application offline, made a lot of changes based on input and feedback that we got, enhanced some of the capabilities using AI, using voice-enabled technology. And so once we launched, just pre-COVID, actually, the solution was readily available to some of those clients whose immune systems are compromised. So having a stranger coming into your home to administer care or support wasn't necessarily an ideal thing because we're all on the lockdown. And so that's a really great example, I think, of some of the work that we've done where we brought together collaborative partners, like-minded individuals looking at complex health issues and in making the investment to solve some of those issues. So this is a quote from Dr. Stuart Howe, who is the CEO for Spinal Cord Injury Ontario. And I'll just sort of let you scan that for yourself. And I'll be moving on to the next segment of the presentation. And I'm happy to take any questions on this specific project as we go forward. So what we're going to do is now we're going to sort of talk about some real issues that some are pre-COVID. And the idea is that going forward, we will have significant challenges to deal with in the healthcare system, whether they are with individuals who were infected by COVID. You would call these long haulers. They've got chronic illnesses, lung, heart disease, mental health issues going forward. How are we going to cope with that on a system that's currently overwhelmed? And also, how do we build for the future? So we're going to look at issues related to income levels, education, wait lists, topics related to funding caps, cost of services. And this is a quote, the poorer you are this is a quote from Health Quality Ontario. And if you aren't aware, Health Quality Ontario is a provincial entity that looks at system level challenges, looking at the quality of care being delivered across the province. They take data from multiple sources and come up with reports around where the gaps are and where things can be improved. So they specifically in this report looked at income, health, and opportunities to achieve health equity in Ontario. Okay. But before I go to Health Quality Ontario, I actually wanted to share this with you because I think it's important that we recognize that spending more money on healthcare is not necessarily the only answer. And so the Fraser Institute, for those who may not be aware, is a think tank based in British Columbia. And you can sort of scan the data here. You can see where we actually spend as a country more. We're one of the highest spenders up there next to Switzerland. But Switzerland has, by spend, so you're looking at issues related to use of resources, okay? Even though they're the number one spender, they've got more doctors, they've got more hospital beds, and their wait list is, what is this, 2 months? Canada, we're second highest in terms of GDP. We've got fewer physicians, fewer hospital beds. So you kind of get the picture as to that the story isn't about healthcare spending. Currently, we spend, at least in Ontario, about 40% of the provincial budget on healthcare. If you've been watching the news, if you've been keeping abreast of anything that's been going on, you'll see that the system is struggling. And this is not just something that happened overnight. This has been decades in the making. Some years ago, Dr. Jane Philpott, who was the federal minister of health in the 2015 Liberal government, had said, healthcare doesn't need more funding. What it needs is innovation. And by innovation, what she meant was not necessarily technology. She meant we needed to be smarter in how we do things, smarter in how we use our resources. And I think this chart sort of indicates that for you, okay? There was another physician, Dr. David Naylor, who in 2014 had put together a report regarding, he was part of an advisory panel on healthcare innovation. This was in 2014. And what they had recommended was looking at a system level approach to modifying and changing healthcare. I don't know how many recommendations from that report were ever implemented, but back to the topic on hand. So as we look at, where do we go from here? What are some of the real big time issues that are facing the sector? I reached out to my own network, my own community, and sort of got some feedback from them as to, from your perspective, you're working in various levels of healthcare. Where do you see some of the challenges are? These are some of the areas that they've highlighted, right? Like waiting lists, funding caps, eligibility, cost of services. They specifically sort of look at mental health. This was recently, but we're sort of looking back. So these are issues that are perennial, if you wish. They're just ongoing. Mental health, addictions, and support. But also for seniors in home care, right? Cognitive impairment issues, falls, these are big topics and big cost areas. Then we looked at virtual care. And as I mentioned earlier on, virtual care doesn't necessarily mean a video call with your doctor. It could mean just email. It could be a phone call. It could be a text message from your physician. You can see this was a study that was done, again, pre-COVID 2019 by the Virtual Care Task Force by the Canadian Medical Association. So here's the need of what Canadians wanted, right? They'd like to book appointments electronically. Currently at that time, only 9% of physicians ordered that. And I think those numbers have probably gone up because what you will all recognize is that the pandemic, COVID-19, has forced rapid transitions or rapid changes to the healthcare system. So things that were resisted at first have now become commonplace in a matter of weeks and months. Okay, so as the CMA talks about virtual care and its impact on the health system. So this is nothing new. I mean, we've sort of known this for a really, really long time. The challenge has always been adoption, right? How do physicians get paid, etc.? How are services delivered? Thinking that through is a very, very complex and very, very complex and expensive process. So where are we now? Like I mentioned, for years we had the Ontario Telemedicine Network, which is one of the largest in the world, but definitely here in Ontario, the largest provider for video call services across the province. And they've been in operation for maybe 20 years. And we're the only entity that were allowed to sort of bill for OHIP visits. So if physicians wanted to do a virtual call, they could only use OTN because that's the only way that they could bill the government for their services. And then obviously there was a bit of disparity between seeing a patient in person versus what they would get paid for a video visit. So typically the video visit was less. And so physicians weren't really incentivized to see anyone by a virtual visit because there was no money in it for them. And that's the reality. Since then, and over the period, we've had a lot of other providers that have emerged. Maple is one that has been around for a while, and they've actually done a fantastic job in terms of their deployment of video and virtual care services, and grew even more so in demand. I think some years ago, they ran a big trial over in PEI, and the level of adoption was really great. So what they did was circumvent some of the barriers that were here in Ontario. We've had other players now, PC Health and so on. Input has also been around. Teladoc, which is an American company, really looking at market opportunities. So over the past 5 years, well, the virtual visits have grown significantly, for 250%, according to the Ontario Auditor General's report, which was published this December. What we're also seeing is the performance to date has not necessarily been that great, however. We have unfortunately allowed too many issues to sort of sit by the wayside, and we haven't looked forward enough or far enough into the future to understand what the needs of the healthcare system would be. And so we've had these challenges, which you would have all read about as a result of COVID, where the system continues to be under great stress. But at the primary care level, I would say that there is certainly more access to physicians using technology. Now I'm going to change and really talk about sort of health quality and income and health. And I'll just take you back to that initial, the poorer you are in Ontario, the more likely you are to have worse health outcomes. This is their data, not mine. I can share the report with you. I'm just presenting what has been researched, validated, and is being presented in their results. So 23%, you can see people with chronic conditions compared to 12 and so forth for folks who are richer. Okay. The lifespan of marginalized communities or people who live in the poorest neighborhoods, on average, would die 2 years earlier than someone who lives in the richest neighborhood. That's women, and men. For men, it's even worse. It's 5 years. So basically, your lifespan is cut by 5 years if you happen to be poor. So we look at mental health, and mental health is just a persistent issue that impacts more than simply that's bigger than your level of access to care. There are long-term issues related to health outcomes, treatment plans, and so forth. So looking at this data, so this is 2011 to 2012, where people in the poorest neighborhoods had 32,000 visits to the emergency room as their first point of contact for mental health. People shouldn't be going to the ER for, that as a first point of contact for mental health. They should be talking to their family physicians about that stuff. Other factors, right? Hospitalization. And you kind of get the picture. Everything here is around cost, it's around resource allocation, it's around the management of resources. So going back to that Fraser Institute chart and the slides and so forth, right? Even though we are spending more, our results aren't that great, which is sort of what this information is conveying to you. And as I mentioned, ideally, I'd like you to form your own opinions, draw your own conclusions. I got 40 minutes to present some information to you. And so I'm just packaging what I think is enough to start a really great conversation and to have you thinking about where we go from here. So what are some of the barriers? Some of these I've sort of referenced, right? Poor local services, income, education, physician payment models. I talked about the fact that prior to COVID, if the physician were to see you in person, they would get paid more than if they were to see you virtually, which makes good business sense for the physician. Doesn't necessarily work for the patient or for the health system, but those are challenges that have been, at least in the near term, resolved. Then there's issues related to internet connectivity, broadband, culture, and so on. So looking ahead, this is a report from Deloitte, and Deloitte's a global agency. Also, Deloitte Health looks at the future of virtual care. And what I want to do is to juxtapose what I just talked about with sort of where the health system is going. Okay, we're behind as far as the effective use or effective use of technology, innovation, but also allocation of resources as far as virtual care, virtual visits. More and more health systems, the partners we work with, this is the direction they're moving in. So looking more to make more investments in these areas for whether it's outpatient services or clinical and preventative services. Outpatient services, inpatient services also are huge areas of opportunity. And as students, as academics, as partners, keeping these areas in mind. So as you develop projects, as you conduct research, looking at where the market's going, and then try to develop solutions to address those areas. So for us, we're looking at opportunities around my thoughts, mobile health clinics, okay, going into the communities to meet those patients directly, okay? Looking at different ways of structuring the healthcare system where you can use more technology in remote care and connected healthcare systems. Record systems integration to address interoperability where one EMR doesn't talk to the other. So you've got multiple health records for the patient. So you've got multiple provincial databases containing a wealth load of information on the health system, which could be used for analysis, system planning, policy making, etc. But more at the operational level, right? Health records that are consistent across the board for the patient. So a really good example, I think, of a good plus practical example of a mobile clinic is actually TELUS. I think they've launched a couple of these across the country. I know just recently, this is the Parkdale, Queen West area. So these clinics, these mobile clinics, obviously they're mobile. They go into the community to see patients, staffed by medical professionals. They're equipped with electronic medical record systems. So it's a good way of getting patients registered on the system, but it's also a good way to deliver primary care services to underserved and marginalized communities. So where do we go from here? And this is a question more for the participants on the call, the students and the academic faculty is, what else can be done? Clearly, we don't have the greatest health system in the world. That's a fact. So what can we do as individuals who are outside of the healthcare system? What can we do to improve the system generally? And it doesn't mean, tearing the whole thing apart and then trying to put it back together. But as you go forward in life, what are some of the innovations? What are some of the ideas, system changes that you can bring that can gradually begin to have an impact across the health system? And then how can you use your knowledge and your training to implement some of those ideas? These are things that we can discuss. So from my own perspective, and this didn't come from me, but it aligned with what I was thinking, so I thought I would share it with you. From the Deloitte report, which talks about, two of the many virtual care strategies they could think of, these are the ones that I thought were most relevant for our conversation today. How do you prepare the workforce for the future? In your programs, it's in your curriculum, it's in your outlook, it's in programs like what MedTech and Adnan are running, right? Getting you connected to the healthcare ecosystem pretty early in your academic career to understand what the challenges are out there. You can take that knowledge plus your own work, your own research, and bring that into the industry. For us, and I think it would be the same for you also, and you've seen that we've demonstrated where we work with partnerships. We recognized a long time ago that we couldn't go it alone. We didn't have the funding, we didn't have the resources, we didn't have the knowledge. We do not know everything. We've got ideas, but other people have ideas. So it comes down to execution, right? How do you get things done in an effective way? Partnerships. I talked about the partnership with Microsoft. There are partners that we work with overseas in academic and health centers. The partnerships with other systems like point-click care and so on to integrate to solve challenges together. So going forward, I'm back to my quote. And what I'd like for you to do is kind of think about what I've said and, within the context of the symbolic hell, but focused more on, yeah, we're going through some hell right now, but we are going to come out, and we are going to come out much better than we are. We're going to come out much stronger. So heat tempered and better than before. How can we start to change the direction in which the healthcare system is going? How can we do more to impact care at the community level? So the mother of two, whose lifespan, based on where she lives, based on her income, is going to be 2 years shorter than someone else's, or that dad, who's going to live 5 years less than someone else of a higher income. How can we address these issues? How can we do more to deliver healthcare services at the community level? That is what I had to present today. So I'd like to thank you very much for your time, for your attention. This was great, and I look forward to your questions. Thank you.
Awesome. Thank you so much for that, Courtney. Really appreciate this. A very insightful presentation and information you've shared about the inequities we still continue to face within the healthcare system. So with that, I'll request Courtney, if you could maybe stop sharing your screen. I'll put on just a screen just to show you, how you can ask questions in a systematic way. So again, the two ways you can ask questions from Courtney is one through the chat function itself, as well as if you'd like to actually speak or come turn on your video and show yourself as well, you're absolutely welcome to do that. What I'll request you to do is there is a raise hand emoticon in Zoom. If you can click that, and then when I name you, if you could please unmute to ask your questions, you can do that as well. So
while we wait, Adnan, I guess people are typing. The issues related to, video virtual care, a lot of the entities, the ones that were basically fee-for-service models. Okay, I mean, now the province is subsidizing a lot of these calls, and there are a lot of physicians who are adopting these capabilities, because I think now there's some parity where that's concerned. But you saw from the slides I presented that even those individuals who may be in need aren't necessarily connecting with their primary care physician. They're going into the hospital, into the emergency room, to access mental health support services. Those facilities aren't set up to do that. So where might some of the opportunities be in terms of connecting those services at the community level with the providers, with the physicians who can deliver, who are trained to deliver those services?
Absolutely. I think so. I mean, I think what you're sharing then there is just, how do we inform the community about the services that are available to them and make it more easily accessible? At the moment, all you think about is you get ill, you run to ER, and then
Absolutely.
now with the pandemic, you get ill, you don't want to go to ER because you're concerned there will be people with COVID that are there. So then especially in like vulnerable communities, like the main way you are accessing healthcare is now not really. It's probably the biggest risk for catching COVID.
Absolutely. And we've seen results, and not just here in Canada, but in different markets where, certainly during the first wave, where hospitals were effectively, I would say shut down, but surgeries were canceled. We've seen results where heart disease and stroke patients, the death rates actually spiked because they couldn't access the care that they needed, because they didn't want to go to the hospital with good reason. And so their quality of life deteriorated, but not only that, they actually died from non-COVID related illnesses. So, in the years to come, and this may be a challenge for the academic folks at McGill or Ryerson, to look at the non-COVID related deaths related to, wave one, what were some of the real factors for that, and how could we have used remote technology to enable these patients to access the care they needed.
Yeah, I understand. So there were some questions that were sent
Perfect.
when participants RSVP'd. So I will ask you those to start. Again, the people are shy in terms of asking questions. Please, again, you're open to ask any questions.
Don't be shy.
But I'll start there. So again, one's a question, just maybe just on a personal level, like what got you into this, Courtney? Like how are you in digital health, trying to integrate solutions and making the system more efficient, the way your organization and you were so driven to do so? So some backstory would be great.
Yeah. Okay. So my background training. So I'm not an academic. I'm not a researcher. I'm not a clinician, and I'm not an engineer. So I guess what sort of driven me is the challenge of trying to solve a really complex problem. So I do have a background in technology and in healthcare. I worked for Advanced Micro Devices under the office of the CTO for global knowledge management. So collaborating with teams around innovation in the semiconductor chip space for mobile phones and so on. And Johnson & Johnson on the medical devices side. And sort of that was where I got my real baptism into the challenges in the healthcare system. So when I left J&J, I had over the period had multiple conversations with physicians and patients, and heard some of their stories and thought, what if I could just use the knowledge I had and the what limited knowledge I had to actually try and solve this problem. And so we started with simple things. We were doing work in peripheral arterial disease and chronic kidney disease with St. Mike's Hospital. Nothing what we do today resembles anything close to what we were doing back then, but it's just scaled. We've been able to build the partnerships through having a clear value proposition, having the drive, the discipline, I guess, to propose bold ideas, and then to not just propose them, to take them on and to develop and execute. So we've been able to grow and scale accordingly.
Awesome. Thank you for sharing that. That's insightful. So it's these other experiences that you've had through kind of developing your career that really brought you to kind of a passion that then now you're chasing and you're delivering on, which is incredible. So one question I have this is from the RSVPs. It seems the participants, feel free to again ask questions if you'd like, but I'll raise one that's from our RSVP list. So what are some main regulatory blocks for new companies entering the medical technology space? So I mean, specifically, I guess with you, it'd be digital health space.
Regulatory would be, so there are multiple levels, I would say, barriers. So there were policy issues. Government policy is usually years behind the technology, and so they're constantly trying to catch up, which is sort of what happened with the whole virtual care environment, but also regulatory. Well, if you're developing, well, let me give you this example. I had a conversation with one of my partners in the Netherlands this morning, and we were talking about, the data gathering, heart rate monitoring, and so on. And there are multiple devices out there that claim to do that type of stuff, but it's not medical grade. So in order to get that medical grade valid, you need to do the clinical research. The data has to be accurate. It has to be repeatable. It has to be consistent. That's being generated. And then it has to be approved by Health Canada. And so, it takes a long time to get done, requires a lot of funding, and then having to go through that regulatory approval, then getting your product on the market, because there's a lot of competition, but also there are a lot of big players in the space, and there are some entities, some organizations that simply prefer to work with big multinational versus small startups. So there are challenges, obviously, but there are challenges the world over in any field. I think if you're committed to what you're trying to do and you believe that there is value add to the health system, that you will be able to get the support and backing that you need.
Thank you for that, Courtney. So we do have a couple of questions now from the chat. So we have one which is about what are some of the technological innovations that you see are being brainstormed or worked on right now in the medical technology industry?
3D, VR, that's a big area. So we currently use computer vision, motion tracking technology. We're using gaming technology. We're using avataring to generate data from motion and machine learning to do analysis. So in a very broad sense, I would say virtual reality. So, Microsoft, our partner, has the HoloLens, which uses AR, augmented reality. And those products have applications in the cognitive healthcare space. So dementia, Alzheimer's, biometrics, so blood pressure monitoring, things like that, especially for a heart disease patient, weight monitoring. But connectivity, I would say, is probably the most important thing. People trust their doctors. They want to be able to connect when they want to. And, so irrespective of the gadgets and the technology, connectivity, I would say, is crucial. And then interoperability, ensuring that the data resides not in one place, but multiple places.
Awesome. Thank you. And I have a couple more questions. So this is great.
I'll try not to be so long-winded.
Yeah, no, that's okay. So how can we explain the discrepancy between provincial funding and the actual effect on our healthcare system? Also, what sectors are being targeted on in the early stages of developing these innovations, and how are they being introduced into the community?
First question as to the why. Well, that's a complex issue, and that would take me more than a couple of minutes to explain. So if you want to invite me back for another talk, I can do that. But I think it's a resource allocation issue, and I think it's just it's complex, but also it takes a lot of courage for a politician to say that they want to make changes to healthcare. So think of it, right? The last time you heard, or if you follow political campaigns like I do, or if you're a political junkie, the moment there's talk of restructuring healthcare or making changes, or then there are other stakeholders with a vested interest who say, oh, you're making cuts to healthcare, you're cutting jobs, and those are very scary words and very scary thoughts to a lot of people who rely on the healthcare system. So I think even if there were courage on, party in power, the blowback is pretty severe, and people are constantly looking for the next election, so they may not necessarily want to touch that issue.
Sorry, I might have turned off your video, Courtney, so please.
That's okay. That's okay. The other question was, sorry, what was the other question?
The other one is, it was around what sectors are being targeted in the early stages of developing these innovations, and how are they being introduced into the community?
So for us, we're actually doing more work outside of Canada than we are inside Canada now. So we've done a lot of our validation work is here. Our R&D is done here, etc. Doesn't mean that we don't, we won't develop in other markets, depending on the need, because there are sometimes cultural issues. But so for us, it's we, like I talked about, we look at musculoskeletal issues, so really complex issues related to motion. Rehab is always a critical part of any post-op surgical plan. So, getting the patient back to work or enabling them to achieve desired functionality. Alzheimer's, dementia, those are significant areas that we're also looking at. But certainly in terms of sort of, as I talked about, both mind and body, right? Helping to bridge that divide, which is pretty significant right now. So that's sort of where our focus is. And we test with partners, sometimes locally or sometimes overseas, but the end goal is always to commercialize with partners.
Thank you. So I'll ask you, I know we're at one, I'll just ask one last one that we have here as a question. I'll ask one part of it.
Yes.
But just before I do that, I wanted to just kind of indicate what you just said there, right? Just because you're creating a business here in Ontario doesn't mean you're just trying to sell to Ontario or you're trying to bring a service to Ontario. You could be looking at other markets. It could be a completely different country that you're looking to deploy your technology into, right? So, so those two things don't need to be exactly aligned where you're just coming up with solutions for the Ontario healthcare system. So think about innovation in your spaces. Like think about that, you could start it here, but it could be for anywhere in the world.
Absolutely. And we've proven that. I mean, we're working with partners in Asia, in Europe, and in the US.
Exactly. So the last question is, again, I think it's a good one with participants here, is around how should students prepare themselves to go into this specific, I'd say, if you could narrow it to the digital health industry, what suggestion would you have in students thinking about, a career in this space?
Work with Adnan on the MedTech program and get an internship.
Thank you for the plug.
Oh, seriously. So we've hired, I mean, honestly, over the years, we've hired maybe 12 co-ops or interns, from different colleges and different universities. And, so if you're interested in that space, there are a lot of companies that are doing some interesting things. Try to get in that way to learn, take on projects, take on tasks, try to understand sort of the big areas, the challenges that they're facing and the problem they're trying to solve, and then apply your expertise to those areas.
Awesome. Well, thank you so much, Courtney. I think that was an incredible presentation, and thank you for the answers you gave for the questions. A lot to think about here. If we're all willing, if we could maybe for a quick sec, if you don't mind unmuting yourselves and just acknowledging Courtney for the time he spent, and you could say thank you or clap as you see fit. Thank you so much. Really appreciate it, Courtney.
You're welcome. Thanks, everybody.
Courtney.
Thank you. You're welcome.
Thank you.
Thank you. All right.
Thank you.
You're welcome.
Awesome. So Courtney, again, thank you so much. We'll be now pausing for, I'll say, about 3-4 minutes, and then we'll start with our Experience MedTech info session. Again.
Awesome. Take care. Take care, everyone. Bye.
Bye. And then Mary Susan, if you don't mind disconnecting the live stream, and then we'll go on it again after.